focus of our programme of research is on understanding the experiences of cancer survivors and people once they've completed their treatment for cancer, and also focusing on developing resources to support people live with some of the consequences they may be facing once their treatment is over.
We're deeply interested in what it means to recover and get back to a healthy, usual life after having an experience of a cancer diagnosis.
The research that we've been conducting here at the University of Southampton over a number of years has led us to develop a conceptual framework to understand how to look at the idea of recovery of health and well-being from cancer treatment, and that people also need support to manage some of these consequences for themselves, and that if they're able to manage them and are supported to manage, then this will enhance their quality of life. We conducted a UK-wide consultation working closely with people affected by cancer as co-researchers. They were trained to work with us in the research team to conduct consultation groups across the UK, and patients were invited to join those consultation groups and have a discussion around priorities for research. The findings from the study highlighted the impact on everyday life as an important consequence of treatment, and this hadn't particularly been understood, that cancer and its treatment had longer term consequences, because much of the research is focused on the time of treatment or end of life. So it was very important in raising the impact on all aspects of life, and this has fed into policy through the National Cancer Survivorship Initiative. The Macmillan Listening Study findings have also been cited internationally. For example, the Australian federal government have encouraged people to work closely with people affected by cancer in the development of services for cancer patients as well as in research.
It's a big problem in the UK and worldwide. Currently, there are around 2 million people who've had a cancer diagnosis and are living with and beyond their cancer treatment. And we think this number's going to double, so that by 2050 there are probably going to be something like 6 million people, cancer survivors in the UK, and many more worldwide. And actually, by that time, we think something like half of the population of the UK will have had a previous cancer diagnosis. So this involves a lot of people. Relatively little has been done in relation to what it means to live in the long term with a cancer diagnosis. This is becoming more and more important as treatment's getting better and people are surviving a long time with their disease. So how they fare after that is very important. Our research has linked directly to national policy in England for health. In particular, the National Cancer Survivorship Initiative. We were instrumental in providing the evidence for making a case for that initiative to government, and also providing some of the evidence that's helped work out what the Survivorship Initiative nationally should address in terms of people's issues and future services. One of the things we really lacked in terms of developing evidence and understanding around what was needed for cancer survivors and the National Cancer Survivorship Initiative was understanding what happens to people and what are the kind of problems people face. And it may be surprising to know, but there wasn't really very good UK data around the ongoing needs of people affected by cancer survivors. People who'd had a cancer diagnosis in the past, when we looked at their health outcomes, they were not the same as people who were healthy and hadn't had any kind of cancer illness or chronic illness. In fact, actually their health profiles on 13 different measures of health and well-being were much more similar to people that had a chronic condition, a serious chronic condition. People with cancer who also had a chronic condition, of which there are quite a number, were worse still actually in terms of their health outcomes. And they were more like somebody who had several chronic conditions. So this was telling us that actually people don't necessarily return to being, after having cancer treatment, the same as somebody who's a healthy person. And also indications that they weren't getting back to their usual employment as much as the healthy people and or in fact some of the people with chronic conditions. So again, this was an early alert to say these are issues that need attending to. One of the initiatives that came out of the National Cancer Survivors Initiative was the decision that what we should really be doing is routinely assessing the outcomes of health and wellbeing outcomes of people who've had a cancer diagnosis after they've finished treatment. This is quite a difficult and complicated thing to do. So what we set out to do was to, in the first instance, pilot the feasibility of doing this. So the Department of Health set up a group to design and develop this PROMS feasibility pilot, and I've been a part of that group. And here in Southampton, we've particularly added expertise to that endeavour around what sort of measures to use, how to design that feasibility trial, and also to provide expertise around how to look at more qualitative data that people might supply through a patient-reported outcome measures survey approach. One of the important areas of work that we've been keen to explore is a group of people that are quite neglected really in cancer research, and that's the needs of people that have not necessarily been cured of their cancer or cancer's come back. Particularly in women with breast cancer. We knew very little about what life was like for people who have what we call metastatic or recurrent disease, but there are now lots of treatments available that help people live with that. So we set out to do a study to initially look at that, and we carefully found all the women we could living with secondary disease, metastatic disease, in the hospitals local to Southampton. And we also used an online survey method to find women across the UK. As part of the study, we also asked if we could follow the experience of 30 women and got enormous insight into how their lives were unfolding over that year. And through the interview study, what we uncovered were women who were leading amazing lives, actually. All of them were carrying on as much as they could as normal. They were working, carrying on with their family lives, trying to be as normal as possible during that time, even though they were living with ongoing disease, and for many of them had quite significant physical and other problems. And we also discovered that actually they weren't really in contact with palliative care services, and in fact actually probably the women, if asked, would have said they didn't want that. But they lacked support and they were really quite socially isolated and found it difficult to talk to their partners, family members about what was going on for them, although really valuing the contact they had with their oncologist, who was probably the only person that they were really in contact with about their condition. And as a result of this work, once published, it's got quite a lot of attention. It was reported in a lot of newspapers, and also was discussed in the House of Lords. And in fact, the charities that funded the work, Breast Cancer Campaign and Breast Cancer Care, set up a task force to look in detail at the needs of women with secondary breast cancer. We now think that we know that there are something like 36,000 women who are living like this in the UK, and there's really quite a mobilising of attention being paid to these women. And in fact, actually, there are now sort of activist women themselves who are working with the cancer charities to make their needs more prominent and be known about.